Welcome to Birch Run Wellness. We're glad to have Dr. Steve here today, and we're also happy to announce that he's going to be actually writing referrals here in the near future.
Well, I'll be writing for medical cards, absolutely.
Right.
I'm planning on doing that a couple days a week, for at least starters, and we can progress to a little bit more of a frequent writing as time progresses. But initially I was thinking of coming to the center a couple, 3 hours, a couple days a week, and seeing individuals that need a medical card, primarily for any of the illnesses that are basically treatable with CBD, THC combinations. And all I'm asking for is for them to bring in a short summary of the illnesses that they have that has been certified by another physician that I could review and move further and write out the medical card.
Well, that's awesome. So he's going to be preliminarily 2 days a week. We're not sure exactly what days yet, but it's going to be coming soon. We'll let you know. And we're also trying to figure out a fair price. We're gonna see what the going rate is in the area, and we're going to make sure that it's affordable for everybody. And I'm sure he's going to be doing renewals and new patients.
Absolutely.
Yep. So he's also a veteran, and I want to thank him for his service. And it's good to have a professional, especially a veteran, someone in this space that actually is looking for an alternative to help his patients. And it's really good to have someone with your status and in our space now, and I appreciate what you've been doing for the movement, and you have big plans for the future. He's actually a cannabis grower, and he plans on growing in the future, and I'm looking forward to that. It's exciting, and he's interested in the dosing, so that's what really got me interested, and that's what I'm really looking forward to in the future, your discoveries on that. And so.
Well, I'll be doing some degree of research and development. I'm currently working with No Veterans Left Behind and a couple other veterans group, and what we're planning on doing is doing a research study with a varying dosing of cannabis and THC combinations to find out which dosing works most effectively for all of the conditions or any of the conditions that have been found successful so far with the combinations of CBD and THC. As Rob had stated, I'm a veteran myself. I was a flight surgeon in the Navy. Did that for 2.5, 3 years. Enjoyed it immensely. Had an opportunity to learn how to fly and all these other good little things. Flown in the backseat of F-18 Hornet jets, landing on aircraft carriers. So, you know, I basically lived a life that a lot of people are willing to pay hundreds of thousands of dollars just to experience. But I had an opportunity to buy a farm up in Michigan as I was working as a physician in a clinic in Indiana. Took advantage of that opportunity, purchased the farm. I was looking forward to growing marijuana outdoors, but eventually realized that I was going to be limited to growing hemp. So that's what I'm doing. But I do have a license as a Class A grower for marijuana, medical, for medical THC. And that licensure is going to be effective for the upcoming year. I'm looking forward to working with Rob in that realm as well. But I'm also working with another group that's affiliated with the Detroit VA. So whether or not I can be working both the Detroit as well as the Saginaw VA is up in the air at this point. But you know, all things are beginning to fold out, and we will have more information as the information comes in.
Absolutely. It's awesome to have someone with his credentials and his experience in this space, and I'm looking forward to working with you in the future in whatever capacity. It's going to be good, and we're going to be helping veterans. We're going to be helping anybody with chronic pain, sleeplessness, anxiety. We're gonna be really looking into the dosing and the different things we can do to help them out, and we appreciate you. Would you like to tell them your full name? I'm afraid to try. So
my last name is Kalesperis. It's a good Greek name, Dr. Steve Kalesperis. I'm a physician as a doctor of osteopathic medicine. Osteopathic medicine, as many of you may or may not know, is basically practices a form of natural medicine. We're concerned about the whole patient as opposed to any specific organ disorder. I do a lot of manipulative therapy as a mode of an alternative mode of therapy instead of using opioid drugs, and that's one of the reasons why I got into, pursuing further investigations into hemp CBD as well as cannabis THC, is because of the fact that I want an alternative to be able to prescribe for my patients. I steer away from opioids as much as possible. Many times I've had patients come into my office looking for a script for chronic pain, for some significant alternative opioids, hard drugs, which I basically had to just turn around and say, if I can't treat you the way I feel is appropriate, then it's best for you to look for another physician. I don't believe in them. I would rather use the alternative, and I'm hoping that this is just the beginning for a future that is more or less opioid free.
That's awesome. That's awesome. Looking forward to that future. And we'll be looking forward to talking to you more. And we're going to be doing these podcasts to keep you updated, make sure you're in the mix with everything. So coming soon, we're going to be announcing the 2 days per week the doctor's going to be here. We're thinking Tuesday, Thursday, what you're saying, maybe
possibly Tuesday, maybe starting out Monday, Tuesday, a back-to-back, because I'd probably be doing a few hours here and a few hours further south on the same day, and then coming back the next day, a few hours there and then a few hours here. So awesome. It'd be a round trip back and forth to the northern part of Michigan where I currently live and have my farm. And then, as I said, I could probably expand that out to maybe 4 days a week, but we shall see.
Absolutely.
Take one day at a time.
We will let you know, too, when that happens. We appreciate your time, and thank you for tuning in.
Very good. Have a good day.